हाय करूँ कौन आया है?
जी मैम।
हाँ मैंने देखा ही नहीं I'm sorry. Hi guys. Hi. Who's there? Mm-hmm. Hello. Hi Maha, Nasreen. Hi Satish. Hi Deepak. Hi Nagmani. How are you guys? Good to have you back. Hi Maha. I'm good, Alhamdulillah. I'm good. Thank you. Hi Satish. Hi Satish. Good to see you. Yes, this is me. So I thought because we are going to start our new chapter, so it's better that you guys see me as well. That how because you have to know me as well, isn't it, in person? Like who we are talking to and who is going to be our teacher. Yeah, isn't it? Hi Deepak. Hi. Walaikum assalam, Nisreen. Walaikum assalam. Walaikum assalam. It feels like I'm taking, the another session of part two. So how are you guys doing? How are you guys, the killing your time? So what's up? What's happening these days? Deepak, what are you doing these days? Hospital?
Only hospital, ma'am.
I know. Round कर लो, Caesar कर लो, deliveries कर लो. Yeah, not more than that. Yes, I know. I hope inshallah result comes good. So you guys will be in another chapter. So it will be very good for all of you. So Maha, how are you? How are you spending your time? Hi Verda. Good evening. Good evening. Yes, I know. Me too. Me too. Me too. And when it is expected? In coming week, right? Hmm?
21st February.
21st February. Okay, today is 4th. Yeah, days. Okay. Okay. Amin. Okay, I will wait for a few more minutes and then we are going to start. We are going to wait and how you are going to utilize your time, right? So Let's get started. So I think we are enough. So let's get started, guys. Okay. So first thing first, you should know that how this exam is going to be, and how and when you can attempt this exam. Okay. Anybody has any idea when you can attempt this exam, part 3 after part 2? In how many years? Hmm? 7 years. Yes. Okay. 7 years. So you have to attempt part 3 after passing part 2. Okay. At least once in 7 years. Okay. Because the total, you can say the time duration of validity of part 3 is going to be 7 years. Likewise for the part 2 as well, that after passing part 1, you have to write part 2 in upcoming 7 years, at least once. Okay. It doesn't mean that you have to pass. It means that you just have to attempt it at least. All right. So, now let me tell you, this is building of RCOG. Okay, this is Union Street building of RCOG, and this is a building where every candidate wants to go for their own ceremony. Okay, because once you are going to get your part 3 degree, or you can say the membership, so certificate is going to be, a ceremony is going to be held in this. And this year it has been held in India as well for the candidates. So the candidates who want to go to India so can go there as well, and UK as well. So this is our Royal College in the Union Street building. Okay. Then yes, you guys are right that we have to attempt part 3 within 7 years of passing part 2. We just have to attempt it. Okay, make sure that it doesn't mean that you have to pass it. And total are 4 attempts. If somebody who cannot pass part 3 in 4 attempts, then they have to write their part 2 again. Not part 1, but part 2. Okay, total 4 attempts, but for the candidate sitting the digital remote exam for the first time, this doesn't count as an attempt. Okay, I will tell you that the how many types of exams are being held these days. Okay, one is physical and the other is digital. Okay, the remote exam. So the candidate who is going to attempt for the first time in this digital remote exam, that is not going to be counted as an attempt. All right, but otherwise 4 attempts are going to be there for if you are going to go for physical exam or face-to-face exam. Then the aim of part 3 should be, if the aim of the part 3 is to assess the candidate's ability to demonstrate core clinical skills in the context of skills, knowledge, attitude, and competence as defined in the MRCOG part 2 curriculum. So basically, this is going to be a final step in becoming member of the prestigious Royal College. This is my, the photo when I was in, the the RCOG convocation. Okay, for my own convocation. So make sure that you are dreaming for this day, because wearing this gown is very much, the kind of beautiful, and even this badge, MRCOG badge. Okay, so you are going to get this badge from the Royal College once you are going to go for your the membership degree. So of course it is going to be very beautiful. So always remember, whenever you are thinking for your own exam, always think that why I am writing this MRCOG, what is my goal. And of course, once you are going to set your own goals, then you are going to dream for that. And once you are going to dream for that, so you are going to achieve that as well. All right. So make sure that you are thinking in right direction. Make sure that you are in your own, the zone to achieve your, the goal. And of course, the once you are going to go for your membership ceremony, that is going to be a kind of dream come true. Okay. So what is the aim? Aim is again is going to be a candidate. They are going to judge a candidate as a whole. Okay, as a whole, the how candidate behaves in exam, how candidate talks to role players, or you can say the patients, and how they are bringing their own clinical skills, their knowledge, their attitude, and whatever we have learned so far in our part 2. All right. So this is going to be our the kind of you can say the exam in which many things are going to be judged and checked. All right. So then what will happen is that basically what this exam is all about. This exam will have total 14 stations. Now we say stations because on every station we have to, talk. We have to face. We have to see. We have to see either simulated patient task in which you are going to get a role player. Role player means, of course, we are not going to get the real patients, but actors. Okay. professional actors. So we call them as role players. Okay. So some of them are going to be simulated patient tasks or the role player task. Some of them are going to be the structured discussion task. All right. So if it is structured discussion task, it means it is going to be one-on-one, the examiner and the candidate. All right. If it is simulated patient task, so of course you are going to see role player, you yourself in cubicle, I mean to say, okay, because we are talking about station. So stations are going to be one after one, like this. All right. I'm sure you all know in many countries it is going to be termed as OSCE, OSPI, or the like in our country it is Stokes. Okay. So I mean in every country I'm sure there are the somewhat we call them as OSCE or OSPI stations. All right. So you are going to see in one cubicle you yourself, role player, and an examiner as well. Okay. The examiner who is going to see how you are talking to the role player or the patient and how you are behaving. Plus, the fourth one could be lay examiner. Lay examiners are those people who are not the doctors, and who are not, the directly associated with hospital or the healthcare professionals. They are going to be either teachers, either lawyers, either social, the workers, or either, the community workers, or, anybody except healthcare professionals. All right. So if you see, the role player and the examiner, this is going to be a good station. But if you see lay examiner, can anybody tell me how lay examiner is going to judge you and on what grounds? What comes in your mind when you just you think about it? Anyone? Just a rough idea, rough the anything. Hmm? Anyone? Any idea? How the teacher is going to judge you? And yes, very good, Sama. Attitude means your complete package as a human being, complete package as an examiner, your behavior, your tone, your pace, your the you can say that how you behave, attitude towards the patient as well. Okay, for example, if somebody is crying, whether you are, the kind of acknowledging. If somebody is in pain, are you acknowledging that pain? Or you are just in your own zone that no, I have to write a prescription, I have to just, do this and I have to go away. Okay, so these lay examiners are going to judge you on, you can say that, the humanitarian grounds, that how you behave with another human being. Are you taking that human being as a human being, or as a just a kind of something that you are just going to go, you are just going to give your whatever you want to talk to him or her, and then you are just going to leave. Okay, so whenever in any station there is going to be a lay examiner, that is going to be a kind of station in terms of high marks. Okay, so it means this lay examiner is going to give you good mark, some marks, and examiner of course is going to judge you how you are talking to the patient, and how you are the behaving towards patient. Plus, are you following the proper domains on which this examiner, we call them as clinical examiner. Okay, so clinical examiner is going to judge you on few grounds, and I'll be talking about that. What domains are they going to follow, and how they are going to give you marks. All right. So lay examiners, always remember when you see lay examiner in any station. So think about that. Okay, this is going to be a high, the marks scoring station. So yes, I have to perform very well, because in exam each single and even half percentage counts in this part 3. Okay, even the single and the even half percentage also counts in this exam, because this is very important, because result is always collective. Every station is going to carry equal marks, but yes, when it comes to lay examiner, so lay examiner will give you some extra marks, and those are going to be counted in your final scores as well. All right. So 14 stations, how you are going to perform in 14 stations, that is also a very good thing. So ideally it is going to be 2 minutes, 2 minutes and 2.5 minutes in online exam, because half minute is going to be for switching from one screen to the other screen. All right, from entering into one room to the other room. But if you are going to be in face to face exam, there is going to be the switch over. one cubicle to other cubicle to other cubicle to the third cubicle and so on. So usually we call it as reading time. Reading time in which you are going to read your question in 2 minutes time only. Then, usually in RCOG and even in the online exam as well, in RCOG, there is going to be a very, the kind of nasty bell, okay? Because the bell will ring from at the start of 2 minutes time, okay? Then at the start of 10 minutes time, and then at the end of 10 minutes time. And that is going to be your start of next 2 minutes time. So this is how, the exam is going to be 2 minutes, then 10 minutes, then another 2 minutes, and then. So this is your job that once you hear the bell, and of course, if you are in online exam, your screen will change. If you are in face-to-face exam, you have to leave the cubicle and then you have to enter into your next station. Okay. So 10 minutes time is going to be inside the cubicle, and that is going to be performance time. In that performance time, you are going to see your question all the time. If you are in online exam, on screen. If you are in face-to-face exam, it is going to be pasted on your table. Okay. So if you have missed something outside, so you can always, the cross check, you can always have a quick check on by seeing on your table again. All right. So usually 5 to 6 are structured discussion. Structured discussions means that, for example, there is going to be a whole scenario on sickle cell disease. Then, for example, I'm your examiner and I'm going to ask you, okay, summarize this case for me. One question. Second is going to be that, okay, take me through that how you are going to give her preconception counseling. Okay. Now she is pregnant and now she is pregnant with 10 weeks time. So now tell me how you are going to manage her in antenatal care. Take me through her intrapartum care. What are going to be the postnatal care checks in the sickle cell disease? All right. If you can just, this is going to be an evolving station, one after one, and it is covering your complete guideline. So basically, structured discussions are going to be, based on guidelines, on, the TOG articles, some of the TOG articles, of course, okay, but not all, but clinically relevant TOG articles, like thyroid disorders in pregnancy, right? We don't have any RCOG guideline. Asthma in pregnancy, we don't have any RCOG guideline, right? When it comes to core surgical skills and the post-operative care, we do have, the perforated uterus, right? Perforated uterus TOG article, we don't have any guideline on that, but perforated uterus is clinically very important, isn't it? Because it can happen after so many, the procedures, isn't it? So it is one of the important structured discussion tasks in our curriculum. When it comes to structured discussion task of the guidelines, then we do have almost all medical disorders in pregnancy, okay, including sepsis, including chickenpox in pregnancy, herpes simplex in pregnancy. So you can see, if anybody who says that, the part 3 is all about communication skills, how you behave, how you talk, it's absolutely wrong. Part 3 is all about how you blend your knowledge of part 2 along with your communication skills. It means you are going to be revising your guidelines and stuff all the time, but not as a whole again, okay? Not extensively like we study in part 2, but yes, that is going to be applied clinical knowledge. All right. So this is going to be your structured discussion. Rest are going to be role players. Out of them, 4 are going to be with lay examiners, and this will carry a little bit higher marks. Some of the stations can be linked station. Linked station in terms of, okay, this is an infertility station and they are seeking to get pregnant for couple of years, and now they are in your, the clinic to have the IVF done, and now you have to counsel her regarding the procedure of IVF and the, the implications and complications, etc., etc. Okay, so this is your one station. The next station could be that, okay, the lady you have seen or the couple you have seen in the previous station, now they become pregnant, and this is their first pregnancy, of course, okay, 6 weeks, 7 weeks, UPT positive, beta HCG positive, but they are presented with OHSS. Now you have to tell us that, how you are going to manage OHSS, or even with OHSS, the linked station could be they conceived and now they have, the twin pregnancy. Take them through their intrapartum care of the twin pregnancy. So you can see that, so many things are going to be linked together in one station. So many guidelines will incorporate. Okay, because in the end you have to make your one station. All right. Then in face-to-face exam, there is not going to be rest station. There is going to be 1, 2, 3, 4, 5, and 14, and that's it. All right. But in online exam, you are going to have a break after 7 stations. You are going to have a break after 7 stations, okay, and that is going to be for 15 minutes. But in those 15 minutes, you are not going to leave your screen. All right, like you are seeing me at the moment, and if we get a break, and if I'm the exam candidate, so I cannot leave my the room, I cannot leave my place. I have to sit here, I have to wait for 15 minutes. That's it. That's all I can do in those 15 minutes. Okay, so that is going to be only in online exam, but in face-to-face exam there is no rest station. Total 168 minutes and it's over. Okay, sometimes in online exam it may take extra time because of some of the the internet lag, some of the the problem in switching over. Sometimes there can be anything, because that is going to be purely based on your internet, right? Because then we are going to be in online world, and that is going to be dependent on so many things, because role player is online, examiner is online, lay examiner is online, you are online, so any internet glitch can happen at that time. So if at all in online exam you feel that your sessions are not going well, so in that scenario you can request rerun. Okay, rerun at least 2 to 3 stations. So the decision of rerun is going to be done by the examiner who was examining you at that time. Plus there are going to be some hidden examiners. Okay, some hidden examiners. So that decision is going to be a collective kind of decision. Okay, and then if they feel that yes, there was an internet lag, there was a problem, and that's why you could not finish your station on time, so yes, you are going to be allowed to have a rerun, and that rerun is going to be for almost 2 or 3 stations, but not more than that. All right, is it clear so far that we have got 2 types of exam, online exam and face-to-face exam? We have got 2 types of stations: structured discussion task and role play task. Clear, everyone? Great, great, good. Hi, Sana. Hi, Sama. How are you? Good. Okay, very good. So I'm trying to make it as simplified as possible. So at least it will be, the easy for all of you to understand that what exactly the part 3 is and how you are going to go about it. All right? Okay, fine. All right. Hi. Okay, so this is basically exam for May 2023. Up till now, I have just the searched RCOG website. There is no update on Part 3 exam, but yes, there are going to be again 2 types of exam. Okay, on-site or face-to-face exam, and the second is going to be online. We call it as a global diet. All right. So the on-site exams for the candidate are going to be in their respective centers. For example, now we have centers UK itself, London, then we have India. In India, we will have almost 3 centers. All right. And then we are going to have Singapore. We are going to have either Singapore or Hong Kong. And this year we had UAE as well. So it was kind of good, isn't it? So we have got a couple of options. So the candidates who are in India and who do not want to travel, they are going to get the seat in their Indian centers. So they do have 3 centers, right? They do have, I think, Delhi, they do have Kolkata, and which one? Another one, in the south. Chennai. Yeah, Chennai. Yes. If I'm not wrong. All right. So 3 centers, then Singapore, Hong Kong, and there is going to be UAE. Yes, it's a good thing. All right. So the candidate who wants to go and travel Singapore or Hong Kong, if it is face to face, then yes, it is going to be good. India, it's going to be good because 3 centers are there. Then UAE, it's a hub, right? So anybody can travel. UK, anybody can travel. And yes, then there is an option of online exam as well. So this is going to be, dependent on your own wish, whether you want to book yourself for online exam or you want to book yourself for on-site exam. So choose wisely, act wisely, make sure that you have your correct, the address on your RCOG website. Which is less stressful? None of them. None of them. Keeping in view of less stress, you can just say travel stress. Okay, travel stress. On what ground? I'm coming to that, sweetheart. Okay, travel stress. If you think that sometimes the people, they are not comfortable in traveling alone, so they do want a companion along, right? So of course that is going to cost more, the travel cost. Then if you don't have anybody where you are traveling, and it's a good idea that don't stay at any relative's place, don't stay at any friend's place. Always choose hotel, okay? Because this is your own exam, and you have to be very calm and poised on the day of exam. Because sometimes, of course, we can't get our home-like environment. Hi, Mona. I'm good. Thank you so much. Alhamdulillah, Alhamdulillah. I wish you guys too as well. I know. Equal, it's a mutual feeling. I'm also, the equally worried for all of you, because I really want all of you to pass and go ahead, because this is now, the high time and right time, isn't it? Okay. So, what grounds? So you have to see your own circumstances, financial burden, okay, mental stress as well. Then comes, the area where you are going. I mean, is there going to be any visa restriction or no? Okay. Is there going to be any, the travel restrictions or no? Is there going to be any kind of where you are going? So sometimes, the people are not, comfortable. Okay. So always remember that, you are choosing wisely, and plus your, you are, the choose your, the address is correct. Okay. So make sure that before your result is announced, your address is correct on your website. Okay. Because RCOG is going to allocate, the exam according to your home addresses. All right. So all of you, please, check your, the RCOG website again for the address and everything, that everything is correctly placed, everything is correct. Okay. So then you are going to be given opportunity to book your exam. All right. For example, if I'm in, the UK, but I want to go to India. So, my, the home address should be of India. Then they are going to give me the seat. Otherwise, they're not going to give me any seat. All right. Likewise, the for us, for Pakistan, the the visa problem is there sometimes. Okay. So make sure that you guys are choosing and the acting wisely. Last time, one of my the candidate from Iraq, she had a very the tough time to even travel to UAE as well, and even from Jordan. So anyone who is from Jordan and Iraq, so make sure that you are trying to get your visa once you think that you have made up your mind, even if you want to write for this exam or no. But make sure that you are processing your the visa by the time you get your result. And if it is good, if you have passed the exam, so go for the visit visa. Visit visa is mostly of 6 months, so I think it is going to be applicable. All right. So make sure that you are not getting visa stress right before exam. So apply for visa once you have they made up your mind that yes, I want to go for this exam. And if you have gotten the seat, very next day book your appointment, okay, and go for the visa. All right. If it is online, then well and well good. For the online, I'll be telling you what is going to be the requirement. All right. So make sure that you are choosing wisely because of financial issues, because of the travel cost, travel anxiety, plus the place you are the going. So this is going to be my humble advice, that don't stay at any relative's place, don't stay at any the friend's place. Always the choose any place, and I think hotel is best. Or the if you are traveling to any place, so there are the certain good places where you can the stay, you can the stay calm, you can stay composed as well for your big day, isn't it? Make sure that you are not putting undue stress on your nerves and on your body as well. Okay. So these are going to be the grounds on which you have to decide for your exam. All right. For candidate who can travel the easily to the any country, so I think this is going to be good for them. But for the candidates who may face any kind of visa restriction, any kind of visa problems, So make sure that you are giving yourself at least 2.5 months time. Okay. All right. All right. So online exam. No silly question. No question is silly question for me at least. Yes, please ask, Mona. Online in those countries. Yeah. Where you don't have exam centers. Okay. It is for basically those countries. But if the places are left, yes, part 3 is online. Part 3 is online as well as face to face as well, both. Okay. So if it is online, it is going to be global. All right. We call it as, the MRCOG global diet. Okay. If it is face to face, it is going to be face to face. If it is face to face, we do have, the centers I have just told. Okay. We do have centers UK, London. We do have India, 3 centers, Singapore or Hong Kong, then UAE. All right. This is going to be face to face. And then the last option is going to be global diet. And yes, another thing. In the global diet, there is going to be difference of fee as well. Okay. Exam fee. All right. Yes, you can take online if you want to. Now let me tell you the biggest difference. The biggest difference is going to be the fee is going to be higher. I think 300 or 350 pound higher than the face-to-face exam. Okay. And yes, Egypt. Oh yeah, how can I forget Egypt? Egypt was a center as well this time. I forgot. I'm sorry. Yeah. So you can see we have got so many centers now. So I think we have got plenty of, the choices. Yeah, Egypt is there, Mona. I'm sorry. I forgot suddenly. And yes, Egypt is a center as well. So if you are in Egypt, so Egypt is going to be, the very good opportunity. For the people who can travel to Egypt, for example, from the Arab countries. So I think UAE, Egypt is going to be a good opportunity for them. Okay. But again, one of my Jordanian, the candidate, she had a very tough time. So I don't know what type of restriction or the tough time she got, but she was very upset. She landed just a night before exam in, her respective center. So make sure that you are, the calculating everything. Okay. All right. So online exam is going to be a computer-based exam. Okay. Yes. Somebody wants to ask anything? Okay. So online exam is computer-based. Like, I mean, you guys can see me. If you guys, turn on your camera as well, so I can see you as well. So this is going to be online exam. And that is going to be through oscillor system. This oscillor system is going to be on the, on the screen like this. You are going to see your questions. You are going to see your, the anything, the questions and everything. You are going to see role player. You are going to see yourself. You are going to see examiner as well on the same screen. Right. And in this system, you don't have to do anything. You will be given a proper, the login like you get for the MedExam Expert website as well. Everybody has their, the login details. Likewise for the oscillor system as well. You are going to get, the login details and everything, and you are going to enter into that system. And one after one, your screen will change. You don't have to do anything. You are just going to sit and wait for the next station. That's it. You're not going to log out. You're not going to log in again and again. Yet you are just going to enter into that system. So we call it as oscillor online system. All right. Candidate, role player, structured discussion, examiner interactions, everything will be like a video conferencing, like we are talking at the moment. All right. So it is going to be online application with remote invigilation. Remote invigilation means like, I mean, if we are at the moment, for example, I'm your examiner, you are my, the candidate, and in the background there are so many, the people who are observing us. So those are going to be, the somewhat invigilators, in which you will have technical facilitators as well from RCOG. They are going to help you if you get stuck at any point, and if you feel that your questions is not moving, your slide is not moving, you cannot see role player, you cannot hear role player. So you can chat with them and you can tell them that, yes, I'm facing this problem. So then they are going to, solve that problem there and then. Okay. So this is, everything is going to be like, I mean, kind of remote in online. So an online exam is going to be, like this. You can see me, I can see you. All right. So yes, make sure that you have your, the one thing is required for online exam. Big, a good, strong internet. Good, strong internet with good internet speed. Okay. RCOG will give you, the check before exam to check that whether that your internet can, take the burden of that, the particular oscillator system or no. Okay, so that is going to be your responsibility. And if anything is happening at your end, RCOG is not going to be responsible. For example, if you have done 8 stations and the 6 stations, were not able to be, the completed or performed, so then it is going to be, the bad. Then maybe, the RCOG will ask you to attempt it next time, or they will cancel your exam, and then you will have to, book another exam. All right. So make sure, for anyone who is aiming for online exam, make sure that you are having good supportive internet with good internet speed. Like me, I work online, so I have 3 internet, the connections at my place. Okay. So if one is not working, I switch to other. If second is not working, I switch to the third one. All right. Likewise for the exam as well, you have to be prepared for everything. This is your job. This is your exam. This is your responsibility. All right. Then on
Sorry,
the day
ma'am.
of exam, oh yeah,
Hi, ma'am. How are you? I miss you so
good.
much.
Miss you too, Mana. Yes,
I'm afraid. I'm scared from result. I don't know why. I don't
I
know, but
know.
I hope, inshallah. I have
Inshallah.
feelings that I will not pass. I don't want to think like that, but inshallah, I have trust in God.
Inshallah, you will
God
pass.
will do the best for me. But
Inshallah,
I
inshallah.
mean, online now, it's also for specific centers.
Well, sweetheart, in this, the November exam, what happened was that, the candidate, for example, the Egypt, the candidate who are, based in Egypt, so they had to go for their face-to-face exam, Egypt. Okay. But for example, if you are outside Egypt, but that's why, I'm telling you that you have to have your address properly mentioned on your website. For example, the many, the Egypt candidates, they are not in Egypt at the moment. They are maybe in, the Saudi Arabia, they are in UAE, they are in UK or Ireland, wherever it is. So if their address is correct on, the place, mailing address, for example,
يعني
if you are in
ma'am,
Saudi
for
Arabia,
example, I'm sorry,
if you
ma'am.
are in
I
Saudi
am
Arabia,
Egyptian. Yeah,
mm-hmm,
I am Egyptian, but I am in Kuwait, residence in
or you're
Kuwait.
in Kuwait, okay,
Yeah, so for this part two,
you
it
will go for
was
online. If you
yeah,
are in
okay,
Kuwait, you will
okay.
go for online. And
Yeah,
if
but
you
also
can
person,
easily travel, then you can go as well.
yeah, also person view, also
No, this is not
person.
your view, sweetheart.
Uh,
It is going to be
uh,
Oslo. You are going to be in your own house with one room.
okay, okay. That
With
I
one
that
room.
I yeah. That this is
I'm
risky.
sitting at the moment in my own house, in my own
But
room.
very risky. This one very risky.
Yes, it is. That's what I'm telling you, sweetheart, that you have
Ah,
to have a very good internet. That's it.
okay, okay.
Nothing more,
Because for
nothing less.
that, yeah, many people will prefer face to face for this.
Exactly. Because
Yeah, yeah.
because many countries they don't have good internet. Many countries they have rainy season in May. Many countries, many countries they don't have the proper weather and proper to the connection, proper anything. So they do prefer face to face as well. So it's all up to you. It's all up to you. All right. If your address is Kuwait, then I think you will be given opportunity to the book from face to face or from online, both. Okay.
Thank you so
So this
much,
is
ma'am. Thank you
yes,
so much.
yes,
I
yes.
hope I will join the part 3 session.
Inshallah,
Course. I hope,
inshallah,
inshallah.
inshallah, inshallah. I'll be so happy to coach you, and of course, I'll be so happy to see you as well. And I hope, who knows, that you see me as an examiner in your exam as well. Who knows?
Subhanallah. It will be my luck. I hope.
Yeah, I hope so. I hope so.
But ma'am, one more question. I'm sorry. I'm
Mhm.
so sorry for
No, no, no,
interruption.
no, no. Please ask.
From part one, from part one, I sent already this, AOT.
Eligibility.
Yeah.
AOT.
Before part two, before part two.
Was it approved?
Yeah, it was
Well,
approved, and I sent for them email
no, no, it's okay. It's okay.
after this previous one,
Mhm.
trial. They told me, خلاص, it's approved
Yes, yes,
forever.
it is approved. It is approved. You don't
خلاص.
have to worry.
Yeah,
Just wait for
yeah,
exam.
alhamdulillah.
But wait for result, inshallah, inshallah. If it is positive, just go
Inshallah.
for exam.
This
Okay?
is the main problem now.
No, inshallah. It will be good. It will be good. Okay? Don't worry. Don't worry. So if anybody who has had sent their AOT, the before 2018 or 19, so it will be accepted. Okay? If it is accepted, so it is more than enough. You don't have to send anything again. Once it is accepted, it is accepted. All right? So just technology. That's it. Like I'm telling you guys, you just need to worry about the technology, and that's it. This is your responsibility to have a good internet system. And plus, on internet system, you have to have this Google Chrome installed. Okay, not other the searching engine like Firefox, like the Mozilla or anything. No. Okay, so you have to have this Google Chrome installed as well. So make sure that you are having computer, Windows 7 or even newer. If it is, the Sierra, it has to be 10 or 12 or even newer. Then Google Chrome should be your web browser. Make sure your Google Chrome is up to date. This is another, the big thing. You have to use desktop, laptop, but you cannot use MacBook or your mobiles, all right, or iPad. Make sure all access has been given to Osler system to have an access like microphone, like camera and everything. Over the head headphones should be used, okay, for the online exam. I'm sure you are getting me. Over the head headphones, right? Because if the headphones are having like this cord, okay, like iPhone headphone, they should not be used because there is going to be echo. If there is an, for the people who do wear hijab or something, there is going to be scratch, okay, scratch with the hairs, and it can cause feedback as well. So everything should be so smooth because you are in online exam. And don't just the think of that, if I'm in online exam, I don't have to behave like a exam candidate. No, you have to behave like exam candidate. You have to wear nice, you have to look nice, you have to look professional, you have to look good as well. Okay, so everything should be like the like we go for our face to face exam, that we dress nice, okay, we look nice, and of course we wear comfortable shoes as well. I'll come to that as well, that how you are going to behave on exam day too. Yeah. So, the Froster system, you don't have to download any system. You will just log in through the given details and that's it. Make sure you are using same device what you have used to check your connectivity, because RCOG will send you the login details a day before exam. So they are going to ask you to have a bandwidth for Osler Online, which is going to be 1.5 Mbps, which I think is very low because I am working online for quite the long. So it has to be even more than that. It is recommended, but it has to be more than that. All right, because every country has the different kind of connection, different kind of connectivity, and different kind of you can say that their the kind of download and upload speed as well. All right. If you're working at NHS, for example, remember not to use NHS Wi-Fi. If you are going to use NHS Wi-Fi, it is going to block your connectivity. Then on the day of exam, what you will do? You will open your login details. You will enter into the system. You will have a system check. You will have a system check. And on this system check, you are going to check your camera, like you are going to see me, microphone, connectivity, quality of Wi-Fi, strength. If you know that, if you have noticed that on Wi-Fi, we always get, the strength. If it is, the lighter one, only one, the little bit more, the powerful than that. And if it is full, it is going to show like this. Okay. So make sure that, you are having a full, the strength, high speed internet. Then you are going to be, you are going to get this screen that, hello candidate, welcome to Osler Online. This is your, the event. This is going to be that this is part 3. This is going to be the date. There is going to be your name, date, and, the start time. Then you are going to proceed. Once you are going to proceed, you are going to click, you will enter into waiting room. If you will enter into waiting room, and then after some time, once everybody will be logged in, because for one circuit there are going to be 14 candidates, isn't it? Because you have to move from one to the other room. 14 candidates, one circuit, and the once 14 candidates will log in and everything will be checked, everything will be prepared, then you are going to start your station. For example, Rubab will start from station number 5, Sama will start from station number 6, Amona will start from station number 7, so and so on. So Rubab will end at station number 5, Sama will end at station number 6. All right. So likewise, This is how it will go. It is not going to be from station number 1 to the station number 14. All right. So this is going to be, the how a person is entering into the waiting room. So, they will go one by one. So then in 2 minutes time, you are going to get your question, how you are going to perform, and how you are going to do that. All right. Where are centers in Pakistan? Nowhere. Online centers. Online centers. No, we don't have any centers, sweetheart. Okay. Unfortunately. And I hope we are working on that. We are studying faculty, whatever we are in Pakistan. Okay. And I have given this, the strong recommendation to our RCOG head in Pakistan, Dr. Nazli. So I hope, in I don't know, not in this year, but maybe, no, sweetheart, no, Pearson, in your own house, like I'm sitting, with your own computer, with your own internet. You don't have to go anywhere. Okay? Rahila, Claire. So this is going to be now your own responsibility, own job, the own duty. You can say that you have to arrange good internet. You have to arrange good, the environment. Of course, it should not be noisy at all. It should not be, the bad. It should not be very dark. It should not be very gloomy, right? It has to be, like you are in exam hall. Okay. So in 2 minutes time, you are going to read your question. And then in the 10 minutes time, you are going to perform. This is going to be your exam time. Once your 1 to 14 stations are finished, then you will enter into again waiting room. Okay. And maybe you will be asked to go log out. Then you are going to log out from system. So this is how this exam is going to be. All right. Then this is how. Walaikum assalam.
I am Samah. How are you?
Yes, I'm good, alhamdulillah. How are you doing? After all what you have been through?
Alhamdulillah, I'm so fine.
Alhamdulillah, alhamdulillah.
Doctor, I just need to understand, to make sure that I understand this correctly. If we are in a country which doesn't have center for the exam itself, okay, they will not suggest you online, to travel to some area or something. You will be the one to choose, either online or, for example, for us as Arabs, to go to Egypt or UAE.
Yes, you can go. You can go.
We will choose at the
you
college.
Can go. Yes, not. No, you can go. All right. So this is, yes, this is going to be, but first, this is going to be according to your, for example, in Saudi Arabia, so far, we don't have any center, right?
Yes.
So you will be given opportunity to book online, or you can go to the, the any other country as well.
Okay. Thank you so much. Thank you.
Welcome. So this is going to be your oscillator system, and this is going to be your screen. Okay, this is computer, right? So this is you. This is your question. All right. This here you will see the timer as well, 2 minutes time. Okay. And this is going to be your reading time. For example, this is your station number 2. Okay. And the role player will come here once your the 10 minutes will start. You, your role player, and maybe your examiner as well. This is a cursor through which you can move this thing up, or if you want to they see another the paper, if you have, so you can use this. Plus this box is going for you. You can they type anything. You can type anything over here. All right. So if you want to type, if you want to, but once you are going to practice, so if you are coming for this the learning, so of course we are going to teach you how you are going to use your 2 minutes time, how you are going to utilize your 10 minutes time as well. All right. So this is going to be your the computer screen on the day of OSCAR exam, and this is how it is going to look. You, your role player, examiner. Now this is 10 minutes time. This is how it will look. So this is your job, that you are having a good room. Like I said, it shouldn't be dark, it shouldn't be gloomy. Okay, it shouldn't be noisy at all. So it should be it should be having your laptop or desktop if you are using, plus the good internet connection. Okay, so this is your job. So you can even sit in your drawing room, in your bedroom, in your own room, wherever you want to sit, but make sure that you are fulfilling almost all requirements. And if at all, if you feel that your place is not that good to accommodate to all this facility, then yes, you can go to some other place as well. But make sure that you are going to that place once you are going to check your requirements 2 to 3 days before exam, and on the day of exam it should be the same place. Not like I have checked my internet and everything here in my place, but on the day of exam I'll be going to another place. So this is not going to happen. Okay, so make sure that you are the thinking and planning and arranging thing the wisely, because even in our country and even in many countries, the internet facility can vary from place to place. All right, if any one of you do not feel that we don't have that the stronger internet or the anything, so yes, move to another good place where you can sit and where you can the have exam. All right, so make sure that you are thinking for the online exam ahead of time, and once it comes for the booking, so yes, now you are ready and you can go for this exam. All right, face-to-face exam is going to be like this, cubicle. For example, this is cubicle number 3. So you are going to get, your question pasted over here. I'm sure everybody is familiar with this, isn't it? We all had, the similar kind of exam throughout our life, isn't it? So one after one, you will be moving, you will be entering, you will be going, and this is how it will look. Station number 1, station number 2, station number 3, 4, 5, 6. All right, so and so, so and so. So this is how it is going to be. One after one, you are going to go you are going to be moving from one station to the other station. All right. In face to face, like I said, there is not going to be any rest stations. Station number 1, 2, 3, 4, 5, 6, blah blah blah. Yeah. All right. Is it clear so far? Mm-hmm. Okay. Then this exam is going to be judged on, okay, domains. We call them as domains, right? So what are domains? Domains are going to be information gathering, like we do in our countries as history taking. So in MRCOG curriculum, it is going to be information gathering. We all are familiar with history taking, yeah, isn't it? So we do it from our, the graduation time, and till date we are doing it on daily basis. Then there is going to be communication with the patient and relatives, communication with colleagues. Third one, it is going to be applied clinical knowledge based on GTG, based on NICE guideline, based on TOG article, right? But it is applied. When we are in our clinics, in our hospitals, when we want to apply anything for our patient, so we don't really read the whole 60 pages guideline to one patient, isn't it? We are going to extract whatever is relevant for that patient, whatever is applied towards that particular scenario, and then we are going to pick that, isn't it? So then there is going to be patient safety. For example, I'm sure, while we were studying for part 2, so we have always been, discussing about few things, that we do not have to give NSAID to so and so patients. Remember, that is patient safety. If you are giving NSAID to particular patient, which guideline clearly says that you don't have to give, it means you are breaching patient safety. You are not a good doctor. All right. So patient safety is going to be, the domain which is going to be tested on almost all stations in part 3. Because what NHS wants a safe, good, practicing doctor for himself, for herself, and for the NHS itself as well. All right. So all these domains are going to be judged. For example, this is a station of breaking bad news. What is breaking bad news? Breaking bad news is in which a doctor has to, the break any bad news which is bad for the patient. Can anybody tell me the examples of breaking bad news? I mean, what do you think could be the bad news for the patient?
IUFD or FS?
Brilliant. IUFT, first of all. Malignancy, brilliant. Okay. Malignancy, IUFT, any congenital anomaly, which is, the not compatible with life. For example, anencephaly, in which you have to offer her termination of pregnancy. That is bad news. Nobody wants to go. Nobody wants to listen to that, right? Miscarriage, brilliant. Then molar pregnancy. Yeah. Then, the anything that is bad for the patient is going to be the breaking bad news. For example, if we are breaking any bad news to the patient, what do you think is going to be tested out of these domains? Communication, isn't it? How you communicate with the patient. Oh yes, empathy, sympathy, how you are behaving, your overall, the tone, your overall pace, your overall, the body posture, even in online exam and even in face to face exam as well. Okay, online exam, how you can show that, the oh yeah, IVF cycle failure. Very good, Satish. This is your domain. So, this is going to be the bad news. So in online exam, how it is going to be tested? How it is going to be tested? From my tone, from my facial expression, from my body expressions. All right. I'm so sorry, Mrs. Gray, to have to tell you this thing, that your report is not as positive as it has to be. And I have some concerning news to tell you. Do you have somebody along to talk to you, or do you want to call in somebody? Because I have to talk to you about your report, and then we have to discuss that how we are going to manage it. Doctor, what it is? Then because you are setting the scene now, and this is going to be from your tone, from your pace. If I'm in the same tone, if I'm loud, look, Mrs. Gray, I have to talk to you because I have to give you your scan report, and this is not very good. And do you have somebody to call in? And are you alone? Are you on your own today? Or do you want to call in someone? Because I have to, to give you news. How it will look bad, isn't it? It will look bad. So you have to bring, even if you are in online exam, even if you are in, the face-to-face exam, we have to behave as a human as well, as a doctor as well, right? Because if we are giving, I'm sure, all of us go through on day-to-day basis. If something bad is happening to our patient, we also feel bad, isn't it? Sometimes for me, because I'm an obstetrician, so of course I sometimes I do face so many, the challenges, plus so many, the tricky cases as well. Sometimes, the in which I feel that, it shouldn't have to have, they happened at all. But sometimes, I do get upset. IUFT is so challenging for me as well. Giving miscarriage news is so challenging, to deliver, to tell somebody that, okay, no, the baby has miscarried, okay, or, the pregnancy has miscarried. So this is so, the kind of emotional, and sometimes we also feel bad as well. So this is all you have to, what you can say, bring into yourself, that how you are going to behave with your patient in your real life scenarios. This is what RCOG wants. So it means that you have to be a good actor. You have to be a good, a kind of simulator as well, that how you are going to simulate, okay, in exam, how you are going to behave. So you have to work on your tone. So this is what, the MRCOG Part 3 preparation courses teaches you. Okay. For in good 3 to 4 months time, if you are going to rehearse with your mentor, and if you are going to practice with her or him, so of course, like, I mean, the candidates who are going to be with me, so of course I'm going to teach them that, look, stop. Now you have to, the slow down. You have to, the lower down your tone. You have to mold your tone. Okay, it should not be monotonous. It should not be in the same tone what you have started. Okay, but when you are coming to certain, the concerning news, bad news, so your tone should be very, the smooth, polite. I'm so sorry for being the bearer of this news, Mrs. Gray. I wish, I had some good news to tell you. Okay, so it has to show from your faces, from your eyes, from your, the tone, from your, the words. The choice of words is very much important. So that's why communication is very much important. And one thing I want to clear here again, this is not going to be English language exam. So don't worry about English language. Nobody is going to judge you that, oh my God, I forgot to put is here, am here, are here, and it has to be past tense. It has to be, the future tense. Nobody is going to judge you on that. How you communicate with the patient and relative, for example, that is going to be judged. All right. So don't forget, don't worry about your, the English is not our first language. So we shouldn't be ashamed of that, if we are not speaking. But if we can communicate properly, so well and well, good. Okay. So don't worry about it as well, and don't be hesitant. And of course, it will come with practice. I was not that fluent when I was preparing for my exam, but of course, with the passage of time, with the, with the, the tons of practices. So of course, now I can, speak fluently. Now I can, the rehearse. Now I can talk. Okay, in terms of, the MRCOG curriculum. So it's never easy. It's never easy in the beginning, but you have to work hard. You have to put your efforts. And for this MRCOG part 3, you have to rehearse. You have to rehearse mean that you have to enact. You have to enact on multiple scenarios. You have to enact on multiple scenarios. You have to rehearse for the multiple scenarios with your, the colleagues, with your mentor. So of course, now they are going to, they talk to you. Now they are going to, they teach you that how you are going to behave in exam. So this is what our, the exam is all about. This is what our training is all about. Because in part 3, what candidates most of the time face is that they don't, because in till part 2, we are not speaking, we are not talking, okay? We are not even, the seeing, me, myself, I haven't seen, the many of you personally, okay? Not even, the online, and not, of course, not because we are connected to online world, all right? But it is very much important that we get used to of each other, because if you are in online or face-to-face exam, then you have to see so many people around. Okay, so make sure that you are coming out of your comfort zone. Okay, you are the facing camera, you are the enacting, you are rehearsing, you are overcoming your fears. All right, so it is very much important. So all you need to do is that you come out, you have to come out from your own shell, okay, from your own comfort zone. You have to speak. It doesn't matter if it is not good, doesn't matter if it is not up to the mark according to the English standard. So who cares? Who cares? This is not an English language exam. If I can understand what you are telling me, so you are a good doctor for me. All right, no, I'm not going to judge you that you I mean you have to use the present tense, past tense, or future tense, and blah blah blah. Nobody is going to judge you on that. All right, so for the people who are little bit hesitant for this as well, so don't worry about it, don't bother about it. You will overcome, and that is going to be only overcome after you are going to practice bunch of stations. Okay, after you are going to listen to some of the stations, you are going to enact. All right, all we have to do is enact, because in many stations sometimes of course we are going to be moving from one station to the other. One station is oncology, other is benign gynecology, other is early pregnancy, other is infertility. It means that we are going to embed ourselves in the different roles. Okay. uh, Maybe not copy, maybe you can the perform better than me, and this is what I want. Everybody has the unique the property, you can say, and the beauty in their own the personality. So maybe you can perform very well, maybe you have a very good tone, maybe you have a very good pace, maybe you have a very good you can say the communication skills. All right, so all I can teach you is that how you are going to perform according to the needs of this exam. Okay, so 5 domains, guys. Patient safety is going to be the utmost priority. If it is breaking bad news, so your major chunk of the the marks are going to be from communication with the patients and relatives. Then it is going to be how you gather the history, information gathering. Then it will come the tiny part from the applied clinical knowledge. For example, if it is IUFT, and if I have to tell her that, look, from now onwards we have to talk that how we are going to deliver you. So are you ready to talk to about it now, or do you want to take your time and discuss with your partner? No, doctor, I want to know about it. All right. So we have got a couple of options to deliver the baby. The first is that wait and watch policy. We call it as expectant management. The second is going to be with the help of medication. The third is going to be with the help of the any kind of the operation if at all it is needed. All right. So because the 80 to 90%, 80 to 90 out of 100 babies, they are going to be delivered in 48 hours time, with the natural process. We call it as the expectant management. If not, then we are going to monitor you with the help of the couple of blood tests. Very easy language. We call it as patient friendly language. We are not going to tell somebody in terms of that you have developed endometrial type 2, you have developed stage 2 endometrial carcinoma. Yes, I did, I know. So endometrial, for example, if it is endometriosis, you have got you got the diagnosis of endometriosis. Endometriosis is when there is going to be presence of endometrial stroma and the glands outside the uterus. We are not going to talk, in this language to the patient. Rather, we are going to simplify it. So RCOG, on the RCOG website, they do have the patient friendly, you can say, a kind of booklet. Okay, and I will send it to you guys as well. So you guys can go through that, because when you are going to talk to the patient, you have to use the simplest, the terminologies and the simple words that a layman can understand. Okay. For example, for the uterus, we say womb. For the ovaries are ovaries. If you want to say, the omentum, that is going to the lining of the tummy wall. For the abdomen, you are going to say tummy. Pelvis is going to be pelvis. Vulva vagina is going to be down below. Okay. So a couple of things which you are going to rehearse, and of course that is going to be possible after a couple of time, after a couple of the sessions or stations practice, then you are going to be the good to go. So this is all going to be learned, and whatever you have learned so far, applied clinical knowledge, that is going to be converted into patient friendly language. Okay. Then remember, each of the 14 tasks will assess between 3 or 4 of the domains to reflect everyday clinical practice, where, for example, communicating with patients is going to be linked with applied clinical knowledge, and communication with colleague will also involve the aspect of patient safety as well. So, in every station, like I said, out of 5, so it is going to be assessed on 3 to 4 domains. And patient safety is going to be the prime domain to be tested on almost every domain. Okay, so you have to pass the almost the good stations, and roughly the pass percentage for the last 5 years, because I know this part 3 exam from 2017. So from 2017 till 2022, the pass marks, the result, are roughly somewhere between 62 to 63%. It's not more than that. All right. So make sure that you are into that zone, that at least you are working for the 75%, 80%. So then of course you are going to pass. One thing more, don't worry about the somebody has scored 89, 88, 90, and I have scored only 62%. So what? This is the result which has to be with you. Pass or fail. That's it. Nobody bothers about percentages. Okay. Okay. So don't bother about the any of the exams percentage as well. So never think of that somebody has scored this much and I have scored this much, so this is going to be counted. No, it's not going to be counted at all. Okay. So how to succeed in this exam? This is important, isn't it? Look confident, appear as a safe doctor, be logical and organized. You have to be sympathetic and empathetic as well, but not that much empathetic. If patient is crying, you are crying as well. Yeah, no. I mean, you shouldn't be having, sometimes we also get emotional, and you will see, a very strong actors and actresses in NHS because they are professional actors. Okay. You will see in Breaking Bad News. I remember I had, the one station of IUFT, and I had to counsel her for post-mortem examination of the baby. And it was just, I think couple of hours of her delivery, and I have to see her in the postnatal clinic, postnatal ward, and I have to counsel her for post-mortem examination. And she was such a fine actress, I must say. She was crying. She was crying with real tears. So I was also, the kind of emotional at that time. It was my first trial. So of course, sometimes, and I was like that, I will lose myself and I will start crying myself as well. So of course, we shouldn't be doing that. And of course, sometimes, we are also human being, and we are doctors as well. Plus, on the other hand, because we do face all these cases in our real life as well, and sometimes these affects us too, personally. Yeah. So we don't have to cry. We just have to be sympathizing with them, be patient, and an active listener. Listen to them. Listen to them. Okay. Just listen to them, what they want to talk, what they want to, the address, what are their major concerns. Okay. Use simple and understandable language in a polite tone. Change your character and be embedded in the role of a doctor in any specialty at the time of station. One. Active listening is the key for this exam. Listening means listening to examiner, what exactly the question is. He has asked management and I am talking about something else. He has asked that what are the risk factors and I am telling about something else. No, patient is talking about that, my major concern is that how long I'll be in the hospital and when I'm going to be discharged from hospital, because I have one son at home and he is special needs. So doctor, please tell me that, when am I going to be discharged from, after this operation? And my major concern is that I have to stuff her with my knowledge that, okay, hysterectomy is going to be like this. You are going to be in hospital for these, the days, and this is how it is going to be. But I'm not addressing her major concern. So this is a complete failure. Doesn't matter if you know each and everything, but if you haven't addressed properly, so you have failed one domain, communication with patient. All right. So active listening is a key for this exam. So listen to what the other person is talking about. Then reasons to fail this exam. We all need to talk about it as well, isn't it? So the reason to fail this exam is failure to have a persistent and a consistent daily practice. Believing the myth that knowledge will not be tested. And this is the biggest myth there is. Candidates, sometimes they are, given this, the wrong, the kind of knowledge about this exam that, okay, no, this is just communication skills knowledge, just, the prep your role player stations, that's it. No, equally, because we have just said 5 to 6 are going to be structured discussion tasks and rest are going to be communication skills tasks as well. Okay. Sometimes believing the myth that it is going to be a pure knowledge or just communication skills. Using too many jargons. Jargons means the medical language. Of course, what a layman will understand if we are going to tell her about the endometriosis, that this is what endometriosis is. This is adenomyosis is. Okay, so we have to use, the very the simplest, the language to them. So for this, RCOG has, the couple of, the patient information leaflets. So from now onwards, what you guys can do is that you guys can go to the RCOG website, you can open patient information leaflet and you can start reading them. There are going to be from, the number 1 to number, I think 57, if I'm not wrong, or maybe something like that. So they are all based on your guidelines. You will really enjoy. Okay, for example, if you will open your, you can say that, okay, let's talk about the miscarriage. So for miscarriage, you will have 2 patient information leaflets. We call them as PIL. Because in our MRCOG curriculum, we love to talk in abbreviations, isn't it? So PIL, you are going to listen to this word quite oftenly once you are going to be in part 3. So for miscarriage, if you are going to download this miscarriage, the patient information leaflet, you are going to read it. You will thoroughly enjoy that this is going to be a guideline, but in patient's language. Okay. Likewise, for the some of the other the guidelines as well, thalassemia, sickle cell disease. Then we do have the chickenpox in pregnancy, herpes in pregnancy. So almost very beautiful patient information leaflet you are going to get from them. If at all you don't see any patient information leaflet on particular topic on RCOG website, you can always Google NHS. Because in NHS we have got plenty of hospital and every hospital has the different patient information leaflet. Okay, all you need to do is you need to learn easy phrases, easy sentences, beautiful phrases. There shouldn't be too many jargons. All right, so this is how you can, and on top of, if you are with me, of course you can tag me, Dr. Zaid, I need this, so I will definitely try to help you. All right, so this is going to be there. Okay, so start reading these patient information leaflet if you really want to be in touch with the studies. So start reading patient information leaflet. I understand this is very stressful time. I've been through this. Okay, but this way or that way you have to be ready for everything. All right, if inshallah you pass, you are going to go for your part 3 exam, so you have to have basic knowledge beforehand. Okay, so you can start reading patient information leaflet and you can download and you can start reading one by one. And I think this is going to give you a very fair idea that how you are going to talk in exam. Then the another big thing is relying. Don't rely on me. Don't rely on the material which is available for you on the website. Don't rely on only courses that no, I have attended 1, 2, 3, 4 courses and surely I'm going to pass. This is not going to give you a good idea. You don't have to rely on anything. The only thing you can rely is you yourself. Be confident. Just think that yes, I can do it and I am going to do it because I have to rehearse. I am not going to go at your place in your exam, right? You have to go yourself. So you can't rely. But on the other hand, you can take every help there is from me, isn't it? You can ask me anything. Of course, I'm going to give you idea. Of course, I'm going to help you with material. Of course, I'm going to help you with how you are going to talk particular in particularly in particular with regard to that particular station. But don't rely on courses or material gathered from here and there as well. This is also the kind of, I think, a habit of almost all candidates, that we really love to collect the books, or we really love to collect material as well. For part 3, let me tell you, sometimes it may help, sometimes it can mislead you as well. In terms of that, you are going to be with false, the kind of positive note in your mind that, I have many things and, I can just revise. But this part 3 needs what you speak, what you behave, how you, talk to the patient, how you talk to the candidate, the role player, how you talk to the consultant or examiner as well. So we don't have to rely anything. Plus, relying on ready-made template we call part 3 station. For example, I have 14 stations from the last exam, and I did try to help my students that, if at all it comes in exam, so you have to, rehearse like this. So if you are taking those templates as your own templates and you are just going to memorize them, this is going to be bad as well. What if role player is not asking you that particular question? So it means that you are going to fail that station because you have rehearsed this according to your own template, and now there is something else. So we don't have to rely on ready-made the templates all the time. You have to be in a the flow. You can say that doesn't matter this question is coming from maternal medicine module, doesn't matter whichever the question is. I know how I am going to start my maternal medicine module. That's it. Because you have already read everything in part 2. Plus, the biggest, the reasons to fail this exam is not believing in yourself. Because many candidates, they feel, or maybe, if they don't get good guidance, so some of the time they do feel that, no, 4 months are not enough. Okay, 4 months are enough, but my English is not up to the mark. I'm not very much fluent. No, so what? Always believe that you can do it. Always remember that English is not our first language and we don't have to pass our English language test. Those are OET and IELTS. Yeah. So don't worry about that. Don't be just like, overconfident. Don't be underconfident. Just be patient. Okay. Just be easy on yourself. And just like, kind of, you can say a very kind of composed candidate. That's it. Yes, and anxiety is real, and we do get anxious, we do get the upset, we do get the very anything, we do get overwhelmed as well. I remember when you guys started with me part 2, so you guys were so upset. I don't know from where to start. Every day, so many messages, every day so many things, I don't know from where to start. And see, and now you are done with your exam. Likewise for this part 3 as well. Sometimes it will be so overwhelming that how am I going to pass? I have to face all these domains. No. With the passage of time, with couple of the consistent and persistent practice, I'm sure you are going to be in that zone that yes, you can go for this exam, you can ace it, and you can crack it in one go as well. All right, clear so far?
Madam, I have a question which may not be related to the exam. Can I ask you?
Yes, please.
It means part 1, you have a scoring percentage. In part 2 also there is scoring percentage. But in part 3, there is only pass or fail.
No,
There also
percentage is there. Percentage is there. Between 62 to 63%. Okay.
So in our success letter they write that percentage.
Sorry, what?
In our success letter, do they write that percentage?
Yes,
or
they do. They do. You will get 2 letters. Okay, one is going to be that yes, you have successfully completed your MRCOG by passing MRCOG part 3. And the second is going to be that exam pass marks were 62% and you have scored 76%. It is going to be there.
Even for part 3?
Yes, yes, yes.
Achha, I was told that part 3 doesn't have percentage. It only
No, no, no,
tells
no,
you that you have
no.
passed. And
Let me
if you
tell you.
fail, they write that in which domain you fail.
No, no,
You
no.
did
Yes,
not
yes,
fare well.
yes. No, no, no. If you fail, there is going to be percentage as well. For example, the 62 was passed and you have scored 59%. All right.
Okay,
But
okay.
and out of 5 domains you have, but you and they say reached the expected standard. Didn't
Yes,
reach
they
the
write
expected
something like that.
standard.
Huh?
Yeah.
Yeah.
Reached the
They only
expected
say
standard.
reach the expected standard,
No, no, no.
but they don't write percentage. That is what I was
No, no, no.
told.
They say. Okay. Every
Okay.
time there is going to be percentage.
And third part, once you pass all the 3 exams, how do you receive the certificate by courier?
Okay. This is another, the question. No, you can receive it with courier, but you are going to get it if you don't want to go for the ceremony. Okay.
Yes.
You are going to get your certificate after ceremony, and usually ceremony is going to be 2 months after result. Okay. And after ceremony, if you want to go face to face, well and well good. If you don't want to go, so you are going to, choose that option on RCOG that I want to receive this certificate in absentia.
In absentia. Okay.
So in absentia, there is going to be a particular fee. So you are going to click on that, and after ceremony, another 4 to 6 weeks, then you are going to get your certificate. Okay.
Okay.
Yes, you can get online as well. You can go, but I will encourage, if you pass and if circumstances allow, please do go. Please do go for ceremony, because it is once in lifetime and everybody will cherish that, the particular day. Trust me, that is going to be so beautiful. And their ceremony is so beautiful. Trust me. Okay. Okay. Good. Hi, Hannah. Hi, Hannah. How are you? I hope you are doing good. Okay. So remember, guys.
One more small question. When you ask the certificate from the RCOG office in courier, do they put up some diplomatic seal or something of that sort, or it comes in our usual blue
No.
dot?
It is going to be complete. It is going to be a complete, the degree. It is going to be this big. If you can see me, this big.
Correct.
Okay?
But how
So
does it come in courier then?
It is going to be in the proper, the courier, and don't worry, it is going to be very safe. It is not going to be
is it like that on the way it is lost or something like that?
No. Their system is so good. Their system, they are going, once they are going to dispatch your degree, they are going to give you a tracking ID, so you can track it all the time whenever you want to. Okay.
Because somebody was telling me here that they ask you some diplomatic seal amount, and then when the courier comes to you, you have to check the seal and then inform them and something of that sort. No, it's not like that.
Nothing like that. Their process is so smooth. Okay.
And one more question. Once you get all the 3 success letters and then you get your final degree, you have to renew the membership every year.
Every year, you have to pay a particular fee. Yes, you have to pay.
And you have to keep on renewing it.
Yes, yes. As long as you want to keep this, the membership in RCOG, RCOG, you have to renew it. Okay, you have to renew it every year. Okay. Good. All right. So the roads to the success and the road to the failure are almost exactly the same. Yeah, the same road, isn't it? So what difference is going to be there? The difference is going to be the correct and the focused guidance into right direction. Then this is going to make a difference that how you can, pass this exam, how you can, the ace this exam in one go, and how you can, the go for, the good direction. All right. So this is going to be there. How much is the renewal fee? It varies. It varies every year. It is somewhere between, I think, 150 to 200 pounds. Okay. Between 150 to 200 pounds. And it varies accordingly. I remember when I gave my first renewal fee, it was 120 27 pounds. Then the next year it was 135. Then because of the economical situation and everything, so it will keep on changing. It will keep on changing. Okay. All right. So what exactly is part 3? So part 3 is basically the combination of your knowledge blended with your communication skills. All right. So knowledge is going to be blended with your communication skills. It is not only knowledge, it is not only communication skills. All right. So let me tell you information gathering. What is information gathering? Now I will tell you briefly about domains as well, in which we are going to talk about the history taking, isn't it? And the history taking starts from where? History of presenting complaint. Then we say history of, first we say the presenting complaint, and then there is history of presenting complaint, or HOPI, history of presenting illness. Then examination. In our real life, what we do? We take history, we do examination, we go for relevant investigation, and then we manage, isn't it? So history, examination is given, or if at all you have to ask, then you will go to the next, which is investigation. Then history should be crisp, it should be structured and focused, so use less jargons, and it should be patient friendly as well. And this will always come from patient information leaflets. Okay, so start downloading patient information leaflets, start reading them slowly, once a day, and I hope, you will be in good flow and you will feel good as well. So while you are going to approach to the patient in calm manner, look confident, greet patient. Hello, good morning. I'm Dr. Qureshi. Like I introduce myself in exam. Hello, I'm Dr. Qureshi, one of the doctor in the exam. One of the doctor in the clinic today. Can I check your name and age, please? Yes, I'm Samantha Gray and I'm 38 years. Okay, so how would you like to be addressed as? Or how would you like me to call you? Yes, Mrs. Gray is fine. All right, Mrs. Gray. So, Mrs. Gray, I understand that you are here to discuss about you are pregnant and you want to discuss about that how this epilepsy is going to be in the pregnancy and everything. Am I correct? Yes, doctor. Or do you want to have to discuss anything in particular in today's consult? Yes, well, doctor, I want to know about that. How the epilepsy is going to be dealt in pregnancy, and how my baby is going to be. Is it going to be any effect on pregnancy? Yes, very good question. In fact, Mrs. Gray. So I'll be discussing all these concerns one by one. So would that be okay if I ask you a couple of questions just to know more about you, since this is our very first meeting? Yes, doctor. Yes. Okay. So can you now? I know that she is a known case of epilepsy. So I have to take history of epilepsy. So what should be the questions? How long, she has been diagnosed with epilepsy? What medication is she on? Is she on any kind of, the specialist, the checkup? When was the last checkup? When was the last fit? Okay. What medications is she on is a very important question. All right. So once we are going to, talk about that, so this is going to help us. So this is relevant. So what is going to be irrelevant? Irrelevant is going to be, if I'm talking about, there's something which is not related to epilepsy, something which is not related to her own health as well. But yes, if at all I have to ask about relevant, so relevance is going to be the family history of epilepsy. Okay, family history of epilepsy, any other sibling having epilepsy, any other children having epilepsy as well. So that is going to be important because that is going to, set the prognosis of the upcoming child as well, isn't it? So history of presenting complaint finished. Then you are going to talk about past medical. Have you had any kind of the operation in your tummy or down below? Because what is our main area to work, in the tummy or down below? All right. So is there any family history of concern, like the having clots in legs or the similar episodes of epilepsy or something? No. Okay, fine. Gynecological history. In obstetrical history, usually we are not concerned with gynecological until unless you really think that it is important. But obstetrical history is going to be important. Okay. So have you been pregnant before? Or is it your first pregnancy? First pregnancy. No, doctor. This is my third pregnancy. Okay. So can I ask about the previous two? Yes, doctor. One miscarried, and the second baby is alive. And when was that? Miscarriage was 5 years ago, and the delivery was 4 years ago. Okay, so was it a vaginal delivery? Yes, doctor. Any the problem in that the during pregnancy and the at the time of delivery or after that? See, you are inquiring about antenatal, intrapartum, postpartum, right? In one go. Okay. Then, are you on any medications at the moment? Yes, doctor, I am on blah, blah, blah. Uh-huh. So now you know that she is on, the any medication which is not pregnancy friendly, which is contraindicated in pregnancy. So you're going to say, oh, I see that you are on these medications, but, I have to put you in touch with your consultant because we have to change these medications to the pregnancy friendly medications because these medications are not considered to be the baby friendly or pregnancy friendly. All right. Yes, doctor. So you have addressed, the major issue. You have achieved patient safety. You have shown your applied clinical knowledge as well. At the same time, okay, history of allergy. Are you allergic to any medication or any other thing? No, doctor. Okay. Personal habit. Do you smoke, drink, or do any recreational drugs? Okay. Or if you want to break these three sentences, you can do always. Do you smoke, Mrs. Gray? Yes, doctor. How many cigarettes? 1 to 2 cigarettes, all right. And how about alcohol? Yes, this party is on weekends, all right. And do you do any kind of recreational drugs? No, doctor. Okay. Or if you want to signpost, you can signpost. Okay. Before, because Mrs. Gray, I have to ask you a couple of, the personal questions. Can I ask? Yes. Okay. Then, you can say, and pardon me to ask, or I'm sorry to ask you this, anything. Socioeconomic history that, what do you do for living? House support at home. It is important. Okay. Then mental health questions, because in the last decade, the mental health, has been linked with, the couple of obstetrical indications, couple of gynecological indications as well. So mental health questions are going to be there as well. We have to inquire Wooley's screening question. Okay, the basic one. Have you been, felt down, depressed, or the having lack in interest in doing things in last 4 weeks? If the answer is yes, yes, doctor, I don't feel, the good. No, doctor, yes, doctor, I was depressed. 2 positive questions, then we are going to send her for the full psychological assessment. Wooley's 7 questions then. Okay, so this is how we are going to do our history, and this has to be in almost 4 to 5 minutes, not more than that. Then you will come to the diagnosis, or then you will come to the management. Then for the information gathering, what sources are you going to use? How you are going to learn? How you are going to learn that how to communicate? NHS choices, like I said, NHS website itself, patient information leaflets on RCOG. You can, they have YouTube channels, multiple YouTube channels of PLAB, YouTube channels of USMLE, YouTube channels of, the PACES, YouTube channel of, there are so many MRCOG channels, even our MRCOG, the MedExam expert channel, we do have a couple of, the informative videos over there. So you can listen to them as well. Okay. Then, you can listen to as many as, for me, myself, how I improved on my communication skills. I used to watch a lot of, the videos on YouTube. It really helped me. Then Vimeo. Vimeo is a website on which we do have, the couple of videos as well. On Vimeo, RCOG has its own channel. So once you will go to Vimeo, you will subscribe to this RCOG channel. So you can get, the couple of videos on that as well. So it will show you that how you are going to communicate, how you are going to behave in exam, okay, in particular station. For example, on Vimeo station, they do have Breaking Bad News, okay. They do have hysteroscopy station. They do have laparoscopy station, okay, the basic one. I think they do have consent of cesarean section as well, okay, if they haven't taken it down. So far, which I remember. But on YouTube, plenty of content is available. So, like I always say that once you are in MRCOG business, learn how to correctly use Google Chrome. You will get each and everything on Google Chrome. You only need to know that what to search and when to search. This is going to be important. For me, I have learned so many things from PLAB, USMLE videos, PACES videos, and the videos of, I'm missing it out. What was that? MRCP, GP, MRCGP. Yeah, sorry, MRCGP, MRCP, medicine, MRCS. So many. If you will watch, the couple of, the videos that how to enact, how to rehearse, how to behave. So I'm sure, you will be in good position for yourself as well. So start, the watching some of them, start observing, start, the reading. So at least you will be in flow that how you are going to go about this, the part 3 exam. All right. Then there is going to be applied clinical knowledge. It has to be comprehensive, evidence-based. All right. And you have to justify investigation and intervention. For example, this is a case of OHSS, and I have to, tell to the patient that yes, we are going to offer some of the basic, investigations. What are basic investigations? I have to look for full blood count. In full blood count, I have to see the baseline hemoglobin status. I have to see hematocrit value as well, because if you are dehydrated, then hematocrit is going to be high. This is going to give me an idea about the level of dehydration. Then I'm going to look for the white cell count as well. Then I have to look for renal status. I will go for renal function test. I will go for liver function test. I might, go for ultrasound, the pelvis for the ovarian volume as well. Okay. So anything. If you want to do any investigation, you have to justify at the same time. Remember, in NHS has to bear each and single thing for the patient. So it is unlike our countries in which we can, ask for a couple of investigations without anything, because if it is, if it is not government funded, so yes, patient has to bear, the all expenses from own pocket. But in NHS, you have to justify. Even full blood count, if you want to go for full blood count, you have to justify that why you want to go for full blood count. Okay. So you have to discuss management options. You have to present a balanced view in terms of risk and benefits of the intervention. Use recommended sources. And what are those recommended sources? We all are, well aware of that. We do have all guidelines. Yeah. We have RCOG guidelines. We have NICE guidelines. We have COG articles. So we know that from where we have to, to bring our knowledge. All right. So applied clinical knowledge is done. So 2 domains are done. Then third is going to be communication. And communication we have spoken about, that you have to appropriate, there has to be appropriate introduction. Again, you shouldn't be like, smiling, with a very wide smile if it is a breaking bad news station, if it is a concerning station, if it is something in which you have to, to bring so many management options. Always, stay very, very, the kind of composed, the candidate. Okay. Don't give, the broad smiles. Okay. It has to be, the half smiley, or if at all you have to smile, yes, you have to smile as well. You shouldn't act as a robot. What's your name? What's your age? How long have you had this? No robot. Okay. You have to bring certain emotions on your face as well, your tone as well. So, the overall, it will look good. Okay. No, doctor, I never had this problem before. Okay, very good. Okay, doctor, I had one miscarriage. Oh, I'm sorry to hear about that. Okay. How are you coping after that? Doctor, this is a station of vulval cancer, for example. This is a hot station of RCOG, vulval cancer, and the patient has been given this news earlier, and her case has been sent to the MDT. Now MDT has sent a letter that, okay, talk to this lady, and they tell her that what MDT has decided for her vulval cancer. So how we are going to start our session. Hello, Mrs. Gray. This is Dr. Qureshi, one of the doctors in the gynecology clinic. Yes, doctor. So, Mrs. Gray, I understand that you are here to discuss about your MDT result for your treatment. Am I correct? Yes, doctor. So, before going on and having a discussion on this MDT, the referral and MDT, the decision that what they have proposed you for the treatment option. Let me ask you that how are you coping with this, with the news of this vulval cancer, Mrs. Gray? I understand it must be quite stressful for you. So do you think that, you need any kind of help from our side? Or, can you please tell me how support around you, how support at home? Is everything fine? See, you are establishing a rapport. Rapport building is very much important. You cannot just, they talk to anyone, and you cannot just, they bombard her with the news that this is the news. Okay. Appropriate introduction, purpose of interaction. You have to have a good rapport. You have to take relevant, concise history. Again, I will say the same: empathy, sympathy, active listening, responding to the cues. Doctor, I had, my mother, she passed away because of, the breast cancer. Okay, and any other sibling? No, doctor. Okay. So how about your personal habit? No, you have to say at the same time, oh, I'm so sorry to hear about that. See, it's a bad thing, and she's sharing her bed, even though you have inquired about it. You have to be, all the time very much, the kind of polite, very much, the kind of sympathetic. All right. So no, doctor. Yes, doctor. I do smoke. How many cigarettes, Mrs. Gray? I do smoke at least 6 to 7 cigarettes a day. All right. And I understand, Mrs. Gray. Let me tell you that smoking overall is not, the good for health. And the once you are going to get pregnant, so it is going to be not good for you and your upcoming baby as well. So would that be okay that if you try to cut down smoking, or if you need any kind of help from our side, so I can also put you in touch with NHS Stop Smoking Cessation Program. Well, doctor, if it is good for my baby, I will try to cut it down. Very good, very good. Thank you for understanding. Okay, so then you will move on to your other whatever you want to ask. Make sure that, of course, at the moment it must be like, overwhelming that Dr. Zaid is telling all these things in one row. But while we are going to practice, so yes, we can easily do all these things in 10 minutes time, because then we are going to be well versed with our communication ourselves as well. All right. So you have to give information, you have to take information, you have to avoid jargons, you have to explain clinical terms as well. You have to encourage dialogue, give information in chunks. Don't just start from A and end up to Z and then take deep breath. No, we have to involve patient. I have given one the chunk of information, then I have to ask, am I clear, Mrs. Gray? Do you want me to repeat anything? Am I clear so far? All right. So it has to be the very nice, it has to be very smooth, and it has to be, you have to look gentle as well, at the same time professional as well. Okay, you have to acknowledge and address patient's pain, patient concern, patient anxiety as well. Doctor, this news has really they brought me into the something that I think I cannot cope with this. I understand, Mrs. Gray. This must be very terrible for you. I know this is such a hard time you are going through. Okay. Do you need that? Do you need any kind of support from our side? Okay. Okay. See, humming is very much important. I see. Okay. I understand. I'm so sorry. I'm so sorry that you have to go through this. I'm so sorry you are going through this. I'm so sorry to have to tell you this. Okay. So all these, the kind of, it may look, the somewhat, you can say, the silly, but it is very important for this exam. Okay, because you have to enact. Nobody knows you. Everybody will know you from those 10 minutes time, how you behave, how you talk, and how you listen. All right. So this is very much important. Then communication with colleagues. When you are going to involve, yes, I have to manage this case with the help of MDT approach. Consultants, which consultant you want to involve in in the care of patient? Yeah, midwife, GP, anesthetist, neonatologist. All right. So you have to make sure that you are involving, because you cannot manage the one patient alone on yourself. Communication, patient safety. Yeah, we have just spoken about patient safety. Usually every day is patient safety day. All right. But if we forget to ask about patient name, age, living status, last menstrual period, BMI, smear history, contraception, if she's on any kind of medication, because that is the biggest safety. Alcohol, smoking, recreational drugs, history of allergy. She is allergic to metronidazole, but I have given her metronidazole as a treatment option, because I know that only metronidazole is a treatment option for her. So what I'm doing? I'm breaching patient safety. I'm not a good doctor. All right. So proper referral is very much important as well. So all these things are going to be almost, the patient safety. The most important the part is going to be that you have to pass this domain, patient safety. Sometimes you have to be a very safe doctor. You have to involve MDT, risk management. You have to initiate DETEX or incident reporting as well, right? I'm sure we have learned incident reporting in our part 2 as well, that for the never events, for the near miss, for the the anything, we have to involve our the risk management process. Then comes how to utilize 2 minutes time. You have to read tasks carefully. You have to check what domains are tested in this task. Don't start making keys. check whether it's a referral letter or no, formulate how you are going to start your station. For me, when I was a student like you, so I had, this problem that how am I going to start my station? Because I have, a pile of information outside. Then my biggest, the concern was that how am I going to, the kind of summarize it, and how am I going to start my station? All right. So this should be your basic concern as well, because this is very much important. Start is always hard, isn't it? So you have to read questions again and again. So, I mean, you are not missing out anything properly from this station. In 10 minutes time, look confident, enter into the cubicle calmly, familiarize yourself with the cubicle. Look, how many people are there in cubicle? Patient, examiner, another person. Oh my God, this is lay examiner station. Okay, the examiner station, it means, okay, yes, this is going to be a good station in which I have to score more on communication. So you are going to train your mind at the same time that, yes, I have to familiarize with the cubicle, with the people. And then at the same time, don't expect that, anyone in the cubicle is going to give you any kind of, the positive note that, yes, you have done well, very good, brilliant. Nobody is going to say a single thing. Nobody is going to give you any kind of hint whether you are going in right direction or bad direction. This is your exam. This is your job. This is your duty. So you don't have to expect anything from even role player as well, even the examiner as well. If at all it is a structured discussion, that's brilliant, very good. You're a very good student. No, 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 not at all. Okay. So don't expect that, if any examiner is with mass space, and if any examiner is not giving you any kind of, the expression, so don't just think of that, I didn't do well. Maybe you have done well, maybe you haven't done well, but this is job of the examiners that they don't have to show any kind of expression from their faces. All right. Even if you have finished your station before time, for example, you have finished your station in 7 to 8 minutes time, and that is quite possible in structured discussion. So just sit calmly, okay? Sit calmly. Don't think here, don't look here, don't scratch your mouth, don't scratch your hairs, don't scratch here, don't look, the kind of, you can say, the untidy, okay? Just sit calmly, you can even, look at your hands in your lap. You can even look at, your table if you are sitting at, anything. But don't be like, kind of, you can say that uncomfortable in that particular environment. Okay. So this is very much important. How to prepare for this exam? This is another, the task. Organize yourself. Organize, like I have said, think of that, inshallah, if I pass this exam, so I'm going to write this May exam. So I have to start, the studying from now onwards. So I'm going to be thinking of all aspects, because this exam needs, the finances. We all know that, because this is costly exam, and the according to our own currency. So we have to, the convert in pounds as well. So make sure that you are having your fee. Plus, if you have to travel, the travel cost. If you have to take any companion along, so companion's cost as well. Plus, if you are traveling, how many days, that cost, hotel cost, okay, everything. Even if it is not the, the face to face, even if it is online, so make sure you have gotten everything ready, okay, ahead of time. So at least once you are going to be close to exam, so you're not going to be, the overburdened, overstressed. Oh my God, I didn't do this, I didn't do this, I didn't do this. For visa, I will say again that please, if you think that, your country or your place where you are residing at the moment can face some kind of visa restrictions, can take some kind of, the visa, the kind of, the anything delay or something. So apply for that visa ahead of time. Okay. Plus, make a comprehensive schedule, keeping in view of your job, household responsibilities, because this exam will also need time. It is not going to be like, just you will go and just you will come out of the exam hall. No. Okay. You have to learn first that what are going to be the techniques, trips, the tips and the tricks. Okay. So then only you are going to be able to go for this exam. So make a comprehensive schedule, keeping in view of everything, circumstances, your job, your household responsibilities. This is a good idea. Look for a good study buddy who is ready to take burden with this tough schedule with you. who doesn't undermine you and make you feel inferior as well. This is very much important because this is stressful time, isn't it? Nobody wants to get stressed out of, there's so many other stresses as well. So study buddy is going to be like this, that, if you are with me, I'm with you. So what we are going to do, that from the practice books, like part 2, we do have practice books for part 3 as well. So from the practice books, we are going to choose, the stations. So one time my study buddy is going to be role player. I'll be the candidate. So she is going to judge me and she is going to be the role player. The next station, you are going to be, the role player and she is going to be the candidate. So make sure that, you are having a candidate who doesn't undermine you, because sometimes, out of something, sometimes, we do, something which shouldn't be done. And sometimes, it can hit somebody, the very hard, and it can be very bad, okay, emotionally, psychologically. And of course, this is going to be a stressful time, keeping in view of all these things, what I have said earlier. Plus, we have to have one, the friend or study buddy who doesn't make us feel inferior. That no, I don't like your tone. No, you haven't read this thing. I don't think that, I can study with you. Okay. So yes, doesn't matter. This should be a trial and error again, because we all in online zone, and we all have, the different time zones. So make sure that if you want to study with someone, so you have to be in the same time zone. So it will be very good for me. For all my 3 parts, I had, my study buddy from India. So basically, we had, the kind of same time zone with half an hour, the difference. So we had very good harmony. We had, the very good kind of understanding, and we were, the study buddy for good, the all 3 parts. So we had, the very kind of course, we are friends till date as well. So, make sure that you are choosing, your study buddy accordingly. Okay, I don't have study buddy, Dr. Zaid. What should I do? I'm crying. Don't cry. Be your own study buddy. Prepare in front of mirror. Prepare, listen to yourself, record yourself. Okay, and listen to yourself. Be your own critic. Be your own judge. All right. Or if you are a part of any course, so, send your template, record yourself, send your template to your mentor. So she will guide you. Okay, and this is what we do in our courses as well. After online sessions, we do have daily activities as well on the the scenarios and questions. All right, like part 2, you do have the daily the activities. So for part 3 as well, we do have daily activities too. So for that, you have to record yourself, you have to send that template, and then I'm going to listen to that and I'm going to correct it. Okay. No. You can't wait for centers, right? Because either you have to travel or either you have to go online. Okay, you can travel to UK, you can travel to UAE. For India, of course, we have certain restrictions, so we cannot go properly, and that is going to be troublesome. So Singapore, if it is face to face, you can go easily. Hong Kong, you can go easily, and Egypt, if you really want to, you can go easily. I had, a very, you can say that, I always want to visit Egypt. So at my time, of course, I never had that opportunity. Otherwise, I would have loved to go to Egypt myself. I have that fantasy to, go to the River Nile and everything. So I hope one day, Mona, I'll be your guest.
You're welcome, ma'am. You're welcome, sure.
Yeah.
Anytime.
Inshallah. I'm planning maybe in, the coming, after your May exam, maybe in June, July, or, the August. This is my plan.
Inshallah.
Inshallah.
Anything you want, ma'am, just contact me. I will prepare everything for you.
Oh, Jazakallah. Thank you so much. That's nice of you.
Inshallah.
I will.
Really, this is honor to us to come to our country.
Inshallah. I will come. I have to come, in fact, and this is my plan for this year, 2023.
Inshallah, sure, ma'am. And I will tell you the best places to visit.
Yes. This is what I want.
Inshallah.
Ah, very good. Very good.
I hope even I will be in Egypt same time you are there.
Yes. Inshallah.
Inshallah.
Okay, so
Thank you.
Jazakallah. You can make your own templates like notes. I always say, okay, you can make your own notes. You can revise them. You can do all available stations in books and then at least revise them, because this is all going to give you, the good kind of, the rehearsal, good kind of opportunity that yes, I have done this station. So at least you are revising. You are going through the same process again and again, and then you can go for that. According to your feasibility, 1 or 2 online courses are enough. Even one is enough. If you are getting good guidance, if you are getting good focused guidance, even one course is enough. Trust me. All you need to do is how you are going to utilize that course, how you are going to utilize that mentor for yourself. That is your job. All right, and that is enough. Trust me. And this is my the humble and sincere suggestion as well. Don't spend the so much of the your the money here and there. Okay, rather than just stay focused, just try to grab as much as the information and knowledge you can get out of that one course. Okay, because every teacher try to help you, every teacher gives the best, every teacher try to give the kind of good I must say the guidance as well. Yeah, so make sure that you are choosing wisely, and if circumstances allow, then you can go book for on-site courses as well. This is also a good option, because in on-site courses you will have a circuit exam like practice. So it will give you a good idea, exam like exam before the exam. Okay. So master on your communication skills and revise your syllabus. So this is going to be a good, the comprehensive agenda, that how you can, the improve on yourself. All right. So let me just give you a brief idea about syllabus. Syllabus is again modules. All right. Teaching, core surgical skills, post-operative care, gynecological problems, sexual and reproductive health, self-fertility, early pregnancy care, antenatal care, postpartum care, maternal medicine, management of labor and delivery, and clinical governance topics. Out of this clinical governance, it is not going to be, something about statistics. Rather, it's going to be bullying, undermining, audit, how to prepare audit, how to critically appraise audit, how to do risk management. Okay, these type of questions are going to be there, and certainly we are going to the rehearse couple of them if we are going to be in our course. Okay, teaching station, how you are going to teach your junior. I am your junior. I have seen the somebody doing vacuum delivery. So doctor, I want to learn vacuum delivery. This is your exam. You are going to teach about vacuum delivery. What are safety points? What is implication? What are contraindications? What are aftercares? Okay, what can be the complications and all? So this is your exam. Okay. One-to-one means if I am your mentor, so I'll be the only mentor. Okay, that is one-to-one. Okay, means one mentor. Otherwise, there are the couple of mentors in one course, if that is a possibility, which these days is not the very much favorable, because everybody wants to be prepared with one mentor. So at least they will be in good flow, good harmony till exam. One-to-one, if they at all you want to take, so that is going to be another possibility. Okay, Sama, clear?
Yes, ma'am, it's clear, because I have asked the mid-exam organizers about part 3. They told me it's 1-to-1. So I thought one student and one mentor. It's not like
No. Usually, like I do take, the 6 to 7 candidates. Okay, only 6 to 7 candidates in one batch. So what will happen is that every candidate will perform in every station, in every session. Okay, if somebody is absent, so he or she will perform twice or even thrice. It depends upon. Okay, so it all depends upon whether you are attending this the session. Otherwise, what will happen is that you are performing one and you are listening to other 6 candidates. So in one session you are performing 7 station, in other 8, in other the 7, 8. So almost altogether you are performing 100, more than 100 stations in one course. Okay, so I think this is very good. This is going to give you a good idea that how you are going to they perform. Second good thing with these the small batches is that you are going to listen to other people as well, because learning is always active and passive as well. You may pick some of the beautiful lines if some of if any of your fellow colleague is using, so you can write it down for you. You can use it next time as well, because in this exam what we are going to learn is how to use small beautiful sentences which can fit with our the station, and which can give us good marks. So this is what it is going to be. AOT, assessment of training. Yeah, if you the last date has been done, Ishaq. It was 26th of January. Okay, 26th of January was assessment of training for this exam, May exam. Okay, and you will get your final answer in like 4 to 6 weeks time. If there is any kind of objection, they will send you that objection as well. But you have to send it till 26th of January. You didn't send, Ishaq? Mm-hmm. Okay, no problem, no problem. Okay, don't worry about it now. Just I hope everybody pass exam and go with the flow and go into that flow of part 3. All right. So this books, this is basic book by Royal College. We call it as Lisa Joel. In part 3 again, you know, we will have names of the books. So this is Lisa Joel. This is Oxford Specialty Task. Okay. Task 4, we call it as, you know, the task book, and sometimes, you know, people call it as OST as well, Oxford Specialty Task, OST. This is you know, the this is Tony Hollingsworth old book. Oh, okay. Inshallah you will pass. Inshallah you will pass. Okay, so Tony Hollingsworth, it is also one of the good OSCE book, but it is little bit old book, but it has quality stations, like I always say for part 2 as well, quality questions. It has quality questions. So you have to perform, you have to, you know, rehearse those quality questions to get a good idea. Then we have get through book as well, like part 2. So we do have part 3 get through. We do have Justin Kune book as well, like part 2. Okay. So roughly, what I remember in this book, 14 and 4, 18 stations are in this book, 89 stations are in this book, 50 stations are in this book, 14, 14, 28 and 6, 34 stations are in this book, and 5 and 14, almost 90 stations are in this book. So you can imagine, if you are practicing almost all these books, you are almost revising your whole curriculum. Plus, if you are in course, if you are revising with your own, you know, the teacher as well, so of course she will give you the proper, you know, the recall stations as well. So side by side, you are going to do the recalls as well. So 200 plus topics, it means 200 plus guidelines or talk articles you are revising on almost all these topics. You are, you know, they're doing the same thing again and again. I think this is more than enough to pass any exam. There is no need to go here and there to look for so many sources, to look for so many courses, rather than staying focusing and, you know, just doing the practice, following the guidelines, following the guidance, more than enough to pass this exam. Okay, clear everyone?
Yes, clear. Dr.
Good.
Zaib, I have another question, please.
Yes,
So
yes.
what is, Doctor, your advice for us to utilize this time? Yani, part of us is already applied for assessment of training and they are able to go for the next exam. Some of us, like me, still we were not able to do this assessment of training thing. That's why we cannot catch the coming exam. So
Doesn't
what is
matter.
your advice to
Doesn't
catch the
matter.
time?
Start. If you pass, inshallah, okay, start over. Start over. Go with the flow, because sometimes it takes time to go with the flow as well, because everybody has different capacity. Okay, everybody has different capability. If you can start your, you know, inshallah, if you pass, so I will suggest that start preparing for this exam from now onwards. Okay, because after May exam, you will get, you know, the November. Okay, so you have to be in flow. If you're not going to study for good 6 months, so what will happen when you will start for your November? You will have to start from scratch. You have to revise your part 2. You have to revise your everything. So if you are going to be in flow, it is going to be good for you. I will suggest
so how to
everyone.
do this, ma'am, while we are still waiting for the result first of all, and we are waiting also for the assessment of training to be done.
Yes, patient information leaflet. Start downloading patient information leaflet. Okay, side by side, start revising your own points if you have made any. Okay, or your own notes if you have made any. So this will give you a compact idea about, you know, the guideline, the topic, and the questions as well. Plus, this is going to be a recommended book to start with. I will send, you know, all these books. Okay, so you can, you know, start reading this book. it will give you the complete, whatever I have spoken today, it will give you the same idea, that how to start, how to do, what are domains, what is exam, and then it will have 14 stations based on 14 modules. All right. So 14 stations, 14 modules. So it will give you a good idea that, okay, out of this module, this type of question can come. Out of this module, this type of question can come. Likewise, in this book as well, it has also modules. Okay. So many modules are based, this is also modules based, the book. This is not module based, but if you are in good flow, then certainly you can get, the idea from this. It has also module wise 5 papers, very good book. It has also, the 2 mocks, 14 stations, and, the 6 stations as well. So altogether, you have plenty of tasks available. So utilize this time. Start reading this book. I will tell you, I will suggest you. Plus, download patient information leaflets and start reading them. It's going to be very, the easy, very interesting as well. That how you are going to, talk to the patient, how you are going to explain, how you are going to, narrate anything. Okay.
Okay, doctor. Thank you so much.
Okay, very good. Okay, this is important, that you should understand the following issues clearly, in a good way. If there is any conflict, if there is any undermining and bullying, maternity dashboard, sexual harassment or sexual abuse, managing angry patient or relative, very important. Okay, principles of confidentiality, audit, risk management. These are, the must to come exam questions. So you are going to find, the couple of practice stations in all these books, and of course we are going to rehearse as well if we are going to be together. So this way or that way, and then of course after all this hurdle, you have to prepare for your big day well, and you just have to ace it. Okay. So remember, the exam day, it has to be very good. Again, you have to rehearse on the same mode that, how are you going to utilize 2 minutes time? Check what domains are tested. Don't start making keys. Check it's a referral letter or no. Formulate how you are going to start the session. Read question again and again. So you're not going to miss anything. So this is how exam is going to be. Okay. In 2 minutes time, you are going to get this type of question. This is a simulated patient task assessing communication with patients, information gathering, patient safety, applied clinical knowledge. Now this is history, case history. 25 years old, Amanda Thomas came to your clinic for booking in her first pregnancy today. This is her first visit in this pregnancy, and she is known case of epilepsy since 13 years of age. She is on anti-epileptic drugs and are concerned about her pregnancy and upcoming baby, as she has read on Google about side effects of these drugs. This Google you will see in exam. Role player will say, doctor, I have been on internet and I have read this thing. Yes, even our patients, they are, the home-based doctors. Everybody is so well read. They know their diagnosis before coming to us. They know their treatment options before coming to us, isn't it? So likewise in exam, you will see a couple of questions as well. You are expected to, now this is your task. What you have to do, take a focus history, address her concerns, give her appropriate advice. So this is your 2 minutes time that, you have to think of that, okay, her name is 25 years and she is Amanda Thomas. And she's known case of epilepsy for last, the 13 years. So she's means 12 years. And she is on anti-epileptic drugs and she is worried about this. Okay. So now how you are going to enter into the station, how you are going to start. This is your exam. Okay. So hello, good morning. I'm Dr. Kuyashi. I'm the doctor in the clinic today. Can I cross check your name and age, please? Yes, I'm Amanda Thomas and I'm 25 years. Okay. So can I call you Amanda? One way. How would you like to be addressed as? Second way. Okay. Second way. How would you like to be addressed as? Okay. How may I call you? Amanda. Anything. Okay. Whichever phrase you like, whichever phrase you are, the well versed with, you can use. All right. Okay, Amanda. So I understand because I have this case history. I don't have to narrate the same history to her. I understand this is your first pregnancy and you are having epilepsy for last 12 years and you are on anti-epileptic drugs as well and now you are concerned. So robotic, isn't it? Change it. Change it. From where you are going to change? She's concerned. She's known case. Okay, Amanda, I understand that you are having epilepsy for last 12 years and Now you want to get pregnant and you want to talk about the epilepsy and the effect of epilepsy on the pregnancy and the effect on the baby as well. Am I correct? Yes, doctor. Okay. So before I go on and discuss, the concerns, is there any particular thing you want to discuss? Yes, doctor, I'm very much concerned that, what is going to happen to my baby. Oh, yes. Then you will start taking your history of epilepsy. Since how long? Okay. What medications is she on? Like, the template, the proper one. Likewise, for the any medical illness, if she is coming with asthma, thyroid disorder, she's a case of sickle cell disease, she's a case of thalassemia, she's a case of anything whatsoever. So this way or that way, we have to take a focus history, we have to address concerns, we have to give appropriate advice. And what is our appropriate advice? Number one, we have to put her in touch with the shared care. We have to involve her doctor. Okay, we have neurologist. We have to change her medications. All right, we have to give her a proper advice for the proper rest, proper the compliance of the drugs, and the sleep, chaperone all the time, and she has to take her medications on time. Plus, if she is fit free for last 2 years, we have to tell her that she is low risk to get fits again in pregnancy. But what would be the conditions in which she can get fits? If she is under stress, if she is not sleeping properly, if she is not taking medications properly, or if she has fit in the last within 2 years time, so then it is going to be, she is going to be high risk of having fits. All right. So this is our appropriate advice. So it means you have fulfilled your task and at the same time you have fulfilled your domain. My communication was apt. My information gathering was okay. I have given her good patient safety advice, like, in terms of medications, we have to change medication. And my applied clinical knowledge was in the lines of RCOG guideline. All right. Clear now that how you are going to see the station and how you are going to perform properly. Any, the brief idea about the stations. Clear, everyone? Yeah. Okay, very good. At least one thumbs up. Okay, good. All right, very good, very good. All right. So this is what exam is. This is what it is all going to be. So make sure that you are preparing for that day. Make sure that you are in a row, that you are utilizing your time properly, and they don't stop. Don't stop when you are tired. Stop when you think you are done. All right. And when we are going to be done, when we are going to finish our MRCOG. All right. And yes, part 2 is, the difficult, because part 2 is bridge between part 1 and part 3. Passing part 2 is really, the kind of a big thing. Inshallah, I hope, pray, and of course, the kind of really wish all of you to pass and go for the next step, make us proud, make me proud. And I'll be so happy to be, the part of your success stories, success, the journey as well, because it really gives, a kind of, you can say that, the pleasure to any teacher, that if any candidate is getting successful and, the moving forward in her or his career. Okay. So I'm sure, inshallah, you guys are going to do that. Just stay calm, stay focused, utilize your time properly, just pray, and that's it. Last year passing percentage was, sweetheart, 62. Now let me tell you my story for part 3 as well. Okay, I have failed part 3 once too. Okay, again I will repeat the same, which I do for just to motivate, not to discourage someone, not to do the something. All right, trust me, I have failed this exam. Pass percentage was 62. I have failed with 60%. Can you imagine that? What would have been my the state of mind at that time? I was so devastated. My the study buddy, the whom I used to the kind of teach or something. So she passed. She passed at that time. Part two, same. The 63, 64, I think, not more than that. Okay, 63, I guess, I believe. When I passed my exam, I scored 86%. This is just to motivate you guys, okay? Don't feel bad, don't be upset. time is going to, they give you, time is going to decide what you are going to do for yourself, which is going to be best time for you. Sometimes, that is not our time. Sometimes, we are missing any question out of, the stress. We are missing, the tiny points. Okay, we are missing out, the sum of the, the points in exam as well. All right. So don't worry about it. Just stay calm, stay focused, and utilize this time. I know this is stressful, but download PIL, start watching videos. Okay, start watching videos. It will give you a good idea that how you are going to, talk in this exam, how you are going to behave in this exam. Okay, go to Med Exam Expert YouTube channel. You will get, the plenty of, the videos done by me, Dr. Hassan, and some of the other mentors as well. So you will get idea. Okay, you will get idea about, the part 3, plus explore more YouTube, like I said, PLAB channels, PACES channel, MRCGP channels, MRCP channel, medicine, MRCS channels. There are plenty of channels. If you will just, the write down in your, the YouTube bar, you will get plenty of videos down there. Okay. So inshallah, I'll be with you, and I am with you, of course. All right. And this was just like, a kind of a session in which I really wanted to communicate with all of you. Plus, I wanted to give you idea about part 3 as well. So you guys will be in the good, the shape, inshallah, once you will get your result. Okay. So always remember, I can and I will, end of story. That's it. Okay. There is no other way out. There is nothing which you cannot do. All right. There is nothing which you cannot do as well. All right. Inshallah, I am with you. My prayers are with you. Doesn't matter part 2, part 3, I'm here. Okay. We all are here at Med Exam Expert, of course. We really want our students to succeed and, the go and, the make us all proud, of course, and make yourself proud as well. This is your success because you are working hard for it. Of course, we are going to be tiny part of it, but yes, we are going to be proud of you, equally proud of you. Okay. Thank you so much, Nasreen. Thank you so much. Really means a lot. Really means a lot. And I'm so happy to see all of you once again after, a long break. So I hope we have had, the kind of good time. And I hope I was able to give you a good detailed overview of part 3. Okay. If still something is not clear, you know where to find me. Send me a text to find me anywhere you want to. All right. My WhatsApp is on, my Telegram is there, Facebook is there, anywhere. All right. All the very best, guys. Inshallah, you guys will, um, rock this exam, and inshallah, you will come for part 3 as well. And doesn't matter this way or that way. Be prepared. All right. Don't just fix your mind. All right. Like I have said that, every exam has 2 results, isn't it? So this way or that way, we have to face every result. All right. Even part 2 or part 3, being a teacher, being a mentor, being a friend, I'm with you. Okay. I'm with all of you. You guys can always approach to me. You can seek any advice if you want to for part 2, part 3, anything. All right. So inshallah, I will try to help you as much as I can with the best of my knowledge as well. So yes, we are open. We are with you at Med Exam Expert. All right. Thank you so much. Thank you so much, Rahila, Nasreen, Sama. Okay. Afaf, Asifa, Asma, Deepak, Mona, Kada, Ishaq, Hana, Jamila, everyone, Maha, Nazish, Rubab, and everyone. Thank you so much, guys. Thank you so much for being so attentive. Okay. Thank you so much for listening to me. Jazakallah. Thank you so much. Thank you. I will see you, inshallah, some other time. Okay. If I plan some other introductory session or some other, the something which could be, the useful as a starter pack. So I will definitely write it for you guys. All right. So make sure you are checking the messages on your group regularly. And of course, we are there and you guys can get in touch with as well. Gada, thank you so much. Okay, guys. See you, inshallah, some other time. Take good care of yourself. All right. Bye-bye. Allah Hafiz.